Welcome tonight. It's a pleasure to have you all here. I am so excited to begin our fall allocations process. So tonight we're going to hear from 6 fantastic agencies. But before we do that, why don't we go around the room and do a round of introductions. So for the agencies, share your name, the agency you're with, and your position. And then for board members, share your name. And if you have a day job, share that as well. So I'll start. I'm Melinda McElhiney, and I get to have the honor of being the chair of this board. During the day, I am VP of Administration for a nonprofit called Run for Women, located in downtown St. Louis.
I'm Dave Barget. I'm Dave Barget. I've been a member of the board since 2009. And during the day, I'm a account manager for a company called Gage Products up in Detroit. We sell fuels and solvents. So that's my thing.
Hi, I'm Cindy Seiberg. I've been on the board longer than Melinda, but shorter than you, and I can't remember exactly when. I am retired from St. Charles Circuit Clerk's office I was there for 42 years. Going the same way.
All right, if you just want to keep going that way, yeah.
Hi everyone, my name is Kara Knight, and I am a student at the St. Louis Crisis Nursery, so I'm doing my internship there this semester. So thanks for having me.
And I'm Lindsay Kayantha. I'm the Program Quality and Evaluation Director with the Crisis Nursery.
I'm Pınar Kürter from St. Charles County Community Development Department. I'm the Community Services Grant Administrator of the county, and I'm helping the CAP board.
Pierre Hampton, Regional Shepherd Administrator for the Salvation Army.
Hi, I'm Bridget McKinney with the Salvation Army Shelter Manager.
Hi, I'm Carrie Diamond, and I am the St. Charles County Coordinator in Oakland for NECAP.
I'm Dottie Castigar, and I am the staff person to the St. Charles, Lincoln, and Warren County Continuum of Care.
Hi, I'm Maddie Fisher, and I'm with Habitat for Humanity of St. Charles County, and I am their Grant and Development Services Coordinator.
Good evening, I'm Robin Bell, and I'm with Youth in Need, and I am their Regional Housing Director.
Hi everyone, my name is Karen Olkemper. I'm the VP of Advancement with Our Ladies in Maternity Homes.
Good evening, I'm Linda Keaton. I'm the Director of Resource Development at Connections to Success.
Brittany Morgan, I'm the Director of Program Services at St. Joachim and Medicare Service.
Hi, I'm Mallory Jones. I'm the Volunteer Coordinator and Data Manager for Bridgeway's Domestic Violence and Sexual Assault Program. We're here representing the Women's Center.
Hi, I'm Mary Jones. I'm the Program Manager for Bridgeway's Domestic Violence Program.
Well, welcome to everyone. It's a pleasure to see you. And John, do you want to introduce yourself?
John.
Hi, John. I think everybody knows John. He needs no introduction. All right, well, why don't we stand if you were able, and we actually have a physical flag in the room tonight, so let's do Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, very good. I will open it up to the floor. Do we have anyone that has any public comments tonight to share? Okay, hearing none, we will move on to approval for, this is just for the CAB members, approval of our meeting minutes from last month, from September 13th. All right, John moves. Do I have a second?
Yes.
All right, any discussion? All right, all those in favor say aye.
Aye.
Opposed, same sign. All right. The records show that those minutes were approved. So we are now officially ahead of schedule. All right. All right, so the way that we want to handle this tonight is, as we shared at the last meeting, is each organization will have 10 minutes to present, and I'm going to put a little timer on my phone so we keep track. So up to 10 minutes to present, and then be able to have a conversation. So board members, you'll have an opportunity to ask questions. We'll have up to 5 minutes for that, so a total of 15 minutes. Any questions on how we will handle tonight's procession proceedings? All right. So then, without further ado, why don't we have our representatives from St. Louis Crisis Nursery present? And I do believe that we need to have you, where do you want folks to go? Up to the front there, right there.
Next to me.
Mm-hmm.
All right. See if the little, oh, it works. That's exciting. All right.
Oh, good.
Well, just let me know when you're ready for me to start.
Oh, you know what? Let me get my clock. I said I was going to do it, and then I forgot. Okay, I have an iPhone. I've not had an iPhone before, and I don't know that I've had to. Where's my clock? Anybody much more? Where do you find the clock on an iPhone?
John, you want to?
I can help you.
John has it.
Okay. Can you be our timekeeper then, John? Please do. Where is it? Okay, I'm over 50. I just feel everyone.
It's all good. It's all good. We help each other out. It's all good.
Those years right now.
There it is.
Oh,
Got it.
Oh, good. Okay.
And then, there you go.
All right. Perfect. Okay. And go.
All right, so my name is Lindsay Kayanka. Like I said, I'm the Program Quality and Evaluation Director for the St. Louis Crisis Nursery. And I just wanted to start off by thanking the board for all of the support that you've provided for the nursery over the years. The CAB board has been a great partner in the work that we're doing, as have all of the agencies that are here today. So I just wanted to start off by thanking you all for that. I do have a slide presentation tonight, but I promise we'll go through it quickly. I just wanted to have a visual, especially for those of you who haven't been to our nursery locations, so you can have a little bit more of an idea about what that looks like. So the Crisis Nursery has been around for 36 years, but we've been in St. Charles County for 30 of those years. And we're really proud of the impacts that we've had during that time. Through our crisis care program, we've served more than 10,000 children in St. Charles County, and that's more than 1 million hours of care that we've provided to kids that are with us. So the Crisis Nursery's mission is really focused on child abuse and neglect prevention and strengthening families. And with that, we target those families within our community who are facing the greatest risk factors for child abuse and neglect. And so that's really where we focus our time and efforts. That's where we have so much overlap with the CAB board, because our population really is those families that do not have the resources available to them to adequately meet their children's needs consistently and to maintain housing. So it's a little smaller than I anticipated it would be, but basically the majority of our children face poverty, live in single parent households with a lack of support, and the majority of our parents have high levels of parental stress. And then in addition to that, it's right around a third of our kids who have experienced homelessness at least once in the last year, if they are not presently homeless when they come to us. So our request to the Community Assistance Board this year is similar to what we've asked in the past, and that is $30,000 to provide critical family stabilization and child abuse and neglect prevention services for 100 children and 50 parents. And so we do that through our core child abuse and neglect family stabilization programming, which is all evidence informed. So I'll touch on these a little bit and also note a couple of the trends that we're seeing. I know we talked a lot about trends at the last meeting, so I want to make sure that I'm hitting those as well. So our 24-hour helpline is really that first point of entry for families who are in crisis. We have received a ton of calls from families in this last year. That is a 24-hour helpline, and it is professionally staffed. The idea is that we're providing resource referrals, support, intervention, and that we can also do schedule intakes into our crisis care program with that. So in the last year, we've had a really big increase in calls. The first year of the pandemic, we had a little bit of a lull as families were sheltering in place, but that picked up in a huge way this last year. And especially with our families experiencing housing instability, families experiencing intimate partner violence, and then mental health crises. And I'm sure some of the partners here today will speak to those trends for their agencies as well. So our emergency crisis care is where a lot of the magic happens. So we're focused in that program on addressing the immediate need of that family to keep those kids safe and make sure that the family has a safe place to go when they're released from us. So our nurseries, we have 2 in St. Charles County. This is what they look like. We've got one in Wentzville on the grounds of SSM St. Joseph's Hospital there, and one in St. Charles on the grounds of the hospital there. So if you're ever driving by those hospitals, keep an eye out for our buildings. So through that program, we are offering short stays for kids. Average is 48 to 72 hours of care. We're focused on addressing that immediate need that brought the family in, whether that's a housing crisis, a mental health crisis for the parent, overwhelming stress, or just an inability to effectively meet kids' needs. And with that program, I think it was on an earlier slide, but 79% of our parents last year said at intake that they were having a really difficult time meeting their kids' needs and weren't able to do that consistently. So we know that our families, when they come in, are really in crisis. For our kids, while they're with us, in addition to that support the parent is going to get from our case manager to address that immediate crisis, we're also providing a lot of services to our kids. We know, again, that these are our kids that are not being seen by other providers. The majority of our kids, more than 3/4, are 6 and under. Most of them are not engaged with a daycare provider. They're not getting regular physicals. So a lot of things are getting missed. So these medical exams that we provide, developmental assessments, the therapeutic approach that we take in the nursery, it's all really vital for that. Last year, 1/4 of our kids, when they got those medical exams, did require prescription medication to address a presenting need. We also had a 1/4 of our kids that were assessed that we found had a developmental concern that required further referral or intervention. So we're really kind of on the front lines with these kids a lot of the time, and the first ones to sometimes point out when there's an issue that's going on. So I wanted to show you a picture of what our nurseries look like so you can get an idea. We're not a daycare. We provide a therapeutic environment. All of our team is trained in trauma-informed care and how to respond to our kids who are in crisis. So you'll notice we've got a garden there. That's our summer garden. Right now it has pumpkins in it, which is kind of fun. But you can see that it's all very homey and very child-focused. So in addition to that, we have our Family Empowerment Program. This is our follow-up program, and within 72 hours, all of our families who use our respite services are getting a call from a social worker or a counselor to try and engage them into some follow-up support. Again, all focused on that family safety and stability and promoting long-term success. So we're looking at things like stable housing, stable employment, stable childcare. We can also do parenting support, so parenting skills coaching, parenting groups, and then help with basic needs items, and even emergency funding in some situations. So we have, you can see there were 342 families here in St. Charles that participated in that last year. And then our impact. We're really proud that we continually meet our target numbers in terms of the impact we're hoping to have on families. So last year, greater than 99% of our kids remained in the care of their parents without a substantiated report of abuse or neglect. And a significant number of our families, 95%, reduced stress by discharge and also were able to meet those immediate safety stability goals. We also had 97% of our parents that had increased skills in the 5 protective factor domains, in at least 3 of those 5. So we're setting families up for long-term success, and we're really proud of the impact that we have. So I'm on track, I believe, for a quick story for you.
You have 3 minutes left.
Yay! Look at that. I knew we were timing this year, so I made sure to watch that. But we're really proud of our numbers, but I always love hearing stories from our fellow agencies because it just kind of gives a face to what this looks like in real life on the ground each day. So I wanted to share about a family that we had come into our Wentzville location over the summer. It was a single mom. She reached out over the weekend. She didn't have a safe place to go, and she had an infant with her and a 3-year-old. And one of the things she said on the phone was, "I don't know if you all are going to take my 3-year-old. Nobody wants him." And that broke our hearts to start with. And so we said, "We want him. Bring him in. Come to the nursery. We're going to figure this out." sat down with mom and found out she'd been really homeless for about since her infant had been born. She'd been staying at motels when she had enough money from a cleaning job to do that. She was also staying with friends sometimes, and she had nowhere to go on this night. So our staff worked with her on trying to get her connected with some other resources in the community. And we took those kids and we made sure that they had a meal right away because everybody was pretty hungry. We got the kids in the tub because they clearly needed a bath. It was summer, so there was, a diaper situation going on there. But we got them all cleaned up. While they were with us, we found that the 3-year-old, who mom said was really bad, that was the word she used for him. She said, he's just really bad, and I don't know why, and I love him so much, but nobody will help with him. And we observed pretty quickly that he was very energetic, and he was having some difficulties communicating. And through a medical exam and with that developmental assessment we do, we noticed that there were definitely some pretty big red flags. And so we were able to get them connected, again, to one of our community partners with FACT. And we were able to connect mom with one of our family empowerment specialists. And so at discharge, we had identified a safe spot for her to be temporarily. And she continued to work with that family empowerment specialist who helped facilitate that connection with FACT, helped her with a plan for getting into a more stable housing situation, and helped her with childcare. And once they were able to stabilize some things with the little guy, she was able to get reliable childcare. And we know that that's so vital for having stable income. Thank you. So once she was able to get reliable childcare for him, she had a stable income. We could help her with that utility or that rent deposit and with some of her utilities because we knew she would be able to make those monthly payments. And about a month ago, she moved into her first own apartment in a really long time with her little ones. We're really proud of her. She's continuing to work with our team on those parenting skills and making sure that we're setting her up for long-term success, not just short-term. So that's what our program looks like in a snapshot. And I'm happy to answer any questions that you have about our program, about the app specifically.
Great. Thank you so much. All right. Yes.
Yeah.
What is the average stay of the child at one of your facilities?
Yeah, so we average 48 to 72 hours. For our families that are experiencing homelessness, it's more in that 72 to 106 hour range. Kids can use us more than once throughout the course of the year if their families need that. But a big piece of why we do that is because we do serve really young kids, and we know that if that separation is too long, it can be really traumatic for the child. And we know that that's hard on the parent too. So we're focused on addressing that immediate need and then working with that parent longer term through our family empowerment program.
I know there's no such thing as a typical example, but what's a typical example of a child showing up at your doorstep? Is mom dropping it off for a timeout, or grandma, or can you speak to that?
Yeah, so most of our kids are 6 and under. So
Right.
usually it's a mom showing up. Most of our clientele are single mothers. Usually there's more than one child. So I would say typical is usually a toddler and an infant. Usually the family doesn't have a lot. We get a lot of kids that come in like without shoes on or dressed inappropriately for the weather. We send home a lot of clothes because of that. A third of our families, again, are currently experiencing homelessness or have in the last year, so they're highly transient. So a lot of times it's about a safe spot to stay. We also get a lot of families where there's a mental health crisis, but across the board for all of our families, it's that high level of parenting stress. So parents that are at the end of their rope, we get, a couple of calls a year at least of parents saying, I don't want my child anymore. I'm just going to bring my child to you and I'm done. Most of the time when we work with that parent, we recognize that that parent loves that child so much and they feel like they're not providing well for them. And we recognize that that parent wants to be a parent, they just feel like they can't, and we're able to provide support so they can continue parenting. So those are, me personally, those are the ones that are the hardest for me as a parent, to see a parent that loves their child so much that they would do that, and that they would trust us with their child too.
Right. Thank you.
So, yeah, thanks.
Other questions?
I have one question that will probably apply to everyone here. So, do you serve any veteran families in need?
We do. It's a small percentage, but we do have some veteran families, but it's not the majority of what we serve by any means.
So, do you capture that as part of the intake information that they're getting?
We do, yeah.
And does it get reported back to
I believe so, possibly. If they ask for that on the surveys they send us, it would get reported back.
I think it was in the application. Hold on a second, let me look. Pull it up.
Yeah, I'm pretty positive that there was a question on here that we had to count them for. It's been a minute since we filled it out, but I'm pretty positive we did have to go through and write a report for that.
Veterans, it's zero.
Is it
so
zero?
It's probably a very small
It's a very,
percentage
like I
then.
said, it's a small number, but there are a couple that kind of come through the woodwork. And we do try to connect them then to like veterans services as much as possible. But yeah.
I had one question. I know that your primary goal is prevention of child abuse and neglect. And recognizing though that a third of your kiddos have been homeless in the past year or currently experiencing homelessness, do you track housing stability once they leave? And can you talk a little bit about that? Because that's what we're interested in. What do your outcomes look relative to that?
Yeah, so for our families that come in and are without housing, we are tracking two different pieces for just their stay in care. So we're looking at one, their stress around housing. Does that decrease from intake to discharge? And then the second thing we're looking at, did they meet their housing goal at discharge? So if they didn't have a safe place, is there an identified safe space that they can stay for at least the next week when they're discharged from care? So that's the short-term goal that we're looking at. And again, it's really capturing those families that have nowhere else to go in that moment and trying to link them with resources that can be a little bit longer term. So we work with some of our shelter partners. We work with Kathy, I think, is on speed dial at Link. We talk to her a lot about helping with different things. But then with our family empowerment program, we do track within that program as well housing goals. And so we track those for up to a year. But post-discharge from that program, we have some limited follow-up, but it's hard to get in touch with people for that. And that is an opportunity for continued growth.
Thanks. Any other questions?
And I should add that the 100 children we're asking for support for through CAB funding are those children who are homeless at intake or have been homeless within the last 12 months and are at a heightened risk for homelessness in the future.
Great. Thank you so much.
Thanks.
Appreciate it. All right, next one is Women's Center.
So would you like us to go up to the podium or? would you like
Can they just grab the mic and bring it over? Yeah, why don't you do that? Absolutely. All right, let me get your. No, I'm not good at multitasking. All right, are y'all ready?
Ready.
Okay, go ahead.
Okay. Hi, everyone. First, I wanted to thank the board for allowing us to come this evening and talk about our domestic violence program. Like Mallory mentioned earlier, we are here this evening representing the Women's Center. Just a little history about the Women's Center. We opened in the mid-1970s under the umbrella of Bridgeway Behavioral Health. We have since merged with Preferred Family Healthcare, and we remain the only domestic violence shelter in St. Charles County. Our sister shelter, called the Terry L. Robertson Center, is in Lincoln County, and it is also the only shelter serving Lincoln County. With that being said, just a little bit about myself. Again, my name is Mary Jones. I'm the program manager with the shelter. I've been a domestic violence advocate since the mid-1990s. And as my children have gotten older, kind of worked my way through the program, but I've got a degree in marketing and management. I really felt a passion for being an advocate when I started at the Women's Center myself. And so here we're going to talk a little bit about what the program looks like and the funding requests and things like that. So today when Mallory and I were talking about the grant, I thought to myself, it just came to me, it takes a village. And I thought, really, as everybody sits here today, we really are the village that helps the under-resourced and the underserved in St. Charles County. And together, the collaboration that we have with other partners, it's what allows us to offer services to our clients. So on behalf of the clients we serve, thank you for that, because it does take a village. I just have some partners here that we work with, of course, Coordinated Entry, Crisis Nursery, St. Joachim Volunteers in Medicine, Salvation Army. All of you are an important part of the journey our clients experience when they come into shelter. So what does shelter look like? It usually starts with a call to our 24-hour crisis hotline. And a lot of times the call will sound something like this: I'm not sure what to do. I don't know what to do. They're calling because something's happened and they don't know who else to turn to. So what I like for our team to be is a resource for not only DV, people who are experiencing domestic violence, but just needing resources in general. Once the call is made, we do what's called an intake. We find out more information about them. And if it's appropriate, if they're experiencing intimate partner violence and we've got space and shelter, we will bring them into shelter. Our program typically, we'd say, was a 4 to 6 week program, but I'm going to talk a little bit about our COVID response at the end this evening. But we now would say we're probably a 6 to 8 week program. So when they're in shelter, they meet with our case manager, who immediately probably gets them started with a call to 211, get that case opened, what kind of services are they eligible for. So once that call is made, they open up the case, and housing, of course, is always number one on our list. Some of the other resources that they work with, and Mallory can chime in here, besides housing would be employment. Most folks are looking for a job, getting their children enrolled in school, engaging in therapy services with our therapist. What else do you say?
We do active safety planning. I do have some statistics here. So we all know that Women's Center was closed down for a little bit due to staffing shortages. However, within the last couple of months, we've came back roaring. So currently, and for the 2 months that we have been open, a little over 2 months, but I'm just going to stick with July and August, August and September, we have served 23 women and children in shelter. We have had 336 hotlines, and then we've unfortunately had to turn away 211 women and 41 kids due to lack of space. We have provided 92 personal advocacy. We have had 62 therapy sessions. We have had 156 safety plans. And then we are starting to track community engagement and community, community services. So recently we've had a 17-year-old that we've been working with another community resource, and we're going to talk about it a little more later, but we're starting to track those statistics. And within the last month, we provided 13.75 or 13 hours and 45 minutes of community support, where we're going out, we're talking and brainstorming with these other community members. So that's a little bit of some other stuff we do. We also help with parenting classes. We also have multiple groups Mary is going to be talking about. Like I said, we've come back roaring.
So when I think of shelter, I think of mind, body, and spirit. I want people coming into shelter not to just identify as a victim of domestic violence, right? These are our neighbors, our coworkers, our friends, our family, and how can we help them on this healing journey? Not just you come in and, of course, you're experiencing domestic violence. Let's help you with A, B, and C. Since I've been in domestic violence, it's gone from the case manager sitting down and saying, Melinda, these are the goals that you need to work on while you're here, to more what we call a consumer focused or client focused, where we ask them, what type of services are you wanting to engage in? And then we offer them the appropriate resources. We also do legal advocacy, so we can help with an order of protection. We also participate in a program through the Secretary of State's office in Jeff City called Safe at Home. It's an address confidentiality program. But going back to the mind, body, and spirit, my vision for someone would be, yes, we're offering you a safe space to come, but I also want, when they're at shelter, to really feel like this is a place where they can heal. And we started what's called an Adopt a Room program. So each of our rooms at shelter have been adopted out by an organization or an individual. So when you walk in that room, instead of it being make do, which was what I always said shelter was, we now have coordinated comforters, paint, some decorative items on the wall. When you come into shelter in this room, for the first time in a long time, these women are saying, I can finally relax. I feel kind of enveloped in this sense of care that we get from coming in these rooms. It's just been great to see women kind of blossom in that situation. So the mind, body, and spirit healing takes place in those rooms and in the shelter itself, just by offering that healing place. So Mallory talked about some of our groups that we've got. We have a DV, of course, DV support group. an affirmations group, which focuses on meditation and relaxation, life skills, art, movie night, trauma-based yoga, and a new group called R&R, which the facilitator has titled Release and Restore. So again, we're talking about domestic violence, but also that whole healing journey. How can we help you develop the life that you want? How can we support you on this journey to leave shelter and really create the life for yourself that you've envisioned? So again, the mind, body, and spirit is really what we're focusing on at Shelter. Some of the, what I call nuts and bolts of the program, in addition to case management and legal advocacy, we do offer therapy for our clients. We've got our 24-hour crisis hotline. We have group programs, group treatments, and then we also have a SART and a DVERT team, which is sexual assault response team or domestic violence response team. How am I doing on time, Melinda?
You've got just about a little under 2 minutes.
Okay. And then real quick, the COVID response, things changed. I'm sure like everybody else's agencies changed during COVID. We went to a 1 person or family per room, and that was recommended by the coalition, again, offering that healing space, of course, the social distancing. They're still recommending it. That's what we're doing to this day. I can't speak for what it's going to look like in a year or 2, but we are currently still placing 1 woman or family in a room. A lot of our services during COVID went virtual, but we've returned, hopefully, to more of a normal environment. So we've resumed services in person, including therapy and groups and things like that. The SART team during COVID, it was so hard to get into the hospitals. Of course, they've reopened since then. Mallory is the head of our SART program, and we are reforming the team, resuming services offered at the hospital for someone who presents having been sexually assaulted. So did you, real quick, that case that Mallory had talked about, we've got success stories too, but here's something that's presented to us, not on a normal basis, but this is kind of the calls that we get. Our partnering agent, Burl Health, called me and had a 17-year-old girl that they were helping out in the Kansas City area. 17 years old, and she has an infant child with her. Not only is she 17 with an infant, she has 3 other children. And I stopped for a minute and listened, and I reread my email, and I said, so that means she was pregnant at 9 and a mother at 10. And they said, yeah, she's also a drug addict, a fentanyl addict. So we were presented with a lot of difficult situations, and that they're looking for resources, and we want to collaborate and provide resources to people. So as everyone here around the table has people that they're working with that need domestic violence services, please reach out to the shelter. We are proud and happy to problem solve and talk to anybody in regards to domestic violence. Okay, thank you.
Very good. Okay, we'll turn it open. Yes, John.
So you help a tremendous number of people, but you also indicated you turn away a significant number of people. So when you say no, then what?
So when we say no, then what? The first call we're going to make is to our sister shelter. So at Robertson Center, if we can't provide the space, then we'll refer to Women's Center and vice versa. So the first call would be to our sister shelter. Do you have space for this family? And what we do then is we provide them with the resources. And I always tell the team, the last thing we should tell them is, if you can't find any space, please call back. But our shelter, it's a transient population. So if someone calls today, it doesn't mean on Friday we're still going to be full. So we always encourage people to call back. But one of the things we do, John, is we resource that with them. What area are you from? Do you have transportation? Is it safe if you're in Lincoln County? Are you safe going up to Hannibal? Kind of taking it case by case basis, providing resources that would be applicable to them.
Do you also work with the people in Warren County?
Yes. I'm sorry, in Warren County? We do, yep. Mm-hmm.
I would say we work with anyone who calls our hotline.
Yes.
We've had a woman who fled all the way from New Zealand, came back to St. Charles and needed a DV program, and we helped her. We've helped refugees. Literally anyone who calls our, no matter where they are in the country. I've had calls from people in Tennessee before, just calling different numbers, reaching out for different services. And then what we do in that situation is we look up those services. We take the time to be like, these are the resources in your area. And if these do not pan out, please give us a call back. We are here we're here for anyone. And that's the unfortunate thing I think all of our programs have kind of ran into is there's not enough space in the homeless shelters. There's not enough space in the DV shelters. There's just nowhere sometimes for these people to go.
So with the Warren County organization, I believe it's Turning Point.
Correct.
So do you make direct contact with them or do you leave it to the individual?
That's a good question. When someone calls for shelter and we pass along a resource, any shelter is going to need to talk to that client. So if we were to make a call to Turning Point and ask for availability, they're going to say we need to talk to that client. It's just standard. We need to make sure they fit in the criteria of intimate partner violence and things like that. So shelters need to talk to the client directly. We can provide the resources, maybe make that initial phone call, but at some point they are going to say we need to talk to the client.
Can you talk about what happens when most of the women leave the shelter? Are they moving into more a permanent housing? What's that next step after they leave you and that follow-up that you provide?
Sure. So the next step kind of just depends on what their situation looks like. We've been fortunate in that we've been able to help people get into Lydia's House. It's the only transitional living program in the area. So transitional living provides more of a long-term housing solution. So I believe it's up to 2 years at Lydia's House. And they also provide domestic violence services. So we've been fortunate to be able to help people get into Lydia's House. To be honest, I mean, housing is an issue for folks right now. And I would not be truthful if I sat here and said everybody leaving has gone on to their own safe and independent housing. It's tough out there. Rent's high, availability is low. But that is the goal of everyone coming into shelter, is to leave in their own safe and independent housing. Our follow-up program, we used to do it 30 days. At the 30-day mark, we would follow up with people if they wanted to participate. Again, it's strictly voluntary. But if somebody said, we would like a follow-up call from you, we used to do it at 30 days. Then we changed because we realized 30 days really is too long. It's too long. If you've got someone with substance use, 30 days is a long time. And when they leave shelter, there's a component of, I think, loneliness that comes because they've had us as a support standing right beside them. I'm sure at Salvation Army, you guys are the same way, or Our Ladies Inn. You're kind of walking through that journey with them, and all of a sudden they're in their own home, and that loneliness sets in where they don't have anybody to come and talk to. So we started making a 10-day phone call. We shortened it from 30 days to 10 days simply because we wanted to make sure we're checking in and touching base with people, and then at that time providing any resources that they may need. That we can continue on. We can go beyond a year. If someone wants that service, we will continue to walk beside them as long as they need us. We don't have a cutoff time for that, but our follow-up is strictly voluntary.
I think we are at time.
Okay.
So thank you so much.
Thank you. Yes, thank you.
Appreciate it. You're good. And next, it is Volunteers in Medicine. Let me get set up here.
I think there's some, I didn't realize we would have this, or I could have brought a slide presentation, but I just made copies for everyone instead. So I'm representing Volunteers in Medicine. My name's Karen Ellman. I'm an RN volunteer. I've actually been a volunteer there for 11 years. Prior to that, I was on the board of directors for 5 years. So I've been with the organization for a while now. Okay, just a little bit about Volunteers in Medicine. We were created 26 years ago, and it was the work of a group of concerned citizens. So it was really a grassroots organization that was founded by concerned citizens because they saw that there was a need. There were people that, what we say, they fall through the cracks. They're not poor enough for Medicaid or Medicare, but they also cannot afford insurance. So that's where we come in, okay? We serve just adult patients who are not eligible for those other types of medical services or assistance. They do have to qualify using financial means every year on a yearly basis, and it's 200% poverty level is what we use. Our patients tend to have chronic illnesses such as diabetes, heart disease, COPD, although some of our younger patients may just be being seen, for, like, I've got a skin rash or something, and I need some help. We do not see children. That's not part of our mission. And when someone turns 65, they go on Medicare. Obviously, they're no longer our patient. And we try to get them ready to make that transition to Medicare, because I don't know if you're aware of this, but a lot of people are moving now onto Medicare and even Medicaid with the expansion, of Medicaid, and the doctors are not available to see these folks on a more urgent basis. So it takes a while sometime to transition that. So we try to work with the patients until they actually get to see a doctor. We're open just 2 days a week by appointment. We are not an urgent care type of clinic. It's kind of like going to your doctor on a yearly or bi-yearly basis. We also have a referral. We refer our patients to a network of providers throughout St. Charles County. We have a list of all the various specialties, as well as OT, PT. Both Barnes, St. Peter's, and St. Joe do our procedures, blood work, x-rays, those kinds of things. And like I said, we have the specialists throughout the county. We are an all-volunteer staff. Not one person is paid. And that we are very proud of, that we've been doing that for 26 years, based on people that have been usually in the medical field, even our clerks, for a long time, and then wanted to continue that. This past year, we were able to add a dermatologist to staff, Dr. Uhlman. Any of you that might be familiar with him, he's been a long time doc in St. Charles County. He retired and he came to work for us. And we're also adding, I think starting the end of this month, we're going to have our own physical therapist. I think the guy that he was running one of the physical therapy sites in St. Charles County, he's retiring, and he's going to come like every other week and actually do therapy for some of our patients. Now we can refer them to the various agencies within St. Charles, but they're, our doctors have said, there are some people that could use some therapy, but not to the extent of me recommending them to go to an outside agency. So this gentleman will be there to do on-site therapy, which I think is great. Our volunteer hours through September of this year are 5166. That is down 20% from the previous year, and I'll kind of talk about our decreasing numbers in a little bit. So one of the things we do every year is we take a look at the value of services that we provide. And this past year, we had over 9,800 on-site volunteer hours. We actually look at that in terms of if we were paying the doctors and the nurses a salary, what would that amount to? And that amounted to about $460,000. So that's basically free services. We provided about $1.5 million in services on a budget of $128,000. So once again, our board president loves to say that we're a great fishes and loaves example to the community in terms of we were able to provide a lot of services for little or no money because of the fact that we're volunteer. We had also 224 off-site referrals to specialists, to PT, to OT, blood work, whatever. So during that particular time. In 21, we had over 4,200 patient visits, which was actually up a little bit from the year before, but I'll explain that in a minute. And then lastly, we had pharmaceuticals that were dispensed. One of the benefits, I think, of our particular organization, unlike some of the other volunteers in medicine organizations, is that we furnish our patients medications and we pay for those medications, either at an outside pharmacy. We work with the SSM pharmacy to provide those, or we have an agreement with Dispensary of Hope, which is a not-for-profit dispensary that provides medications to not-for-profit organizations. And we're able to, basically for $7,500 a year, we're able to get unlimited amounts of the medications that are very, very common, like for your blood pressure or psych meds or cholesterol meds, things that we use a lot of. So we're not paying more than $7,500 in a year's time for all of those medications, which has really decreased our cost over the last several years. We also provide medicines through pharmaceutical companies. A lot of our patients, they need, specialty medicines for, certain types of dermatological conditions. Inhalers, we have a lot of patients with COPD, they need inhalers. Inhalers are anywhere from, $300 to $500 per inhaler. Obviously, we have a budget of $50 per script. That's our cutoff, to the outside. So we're able to get those kinds of prescriptions through what's called pharmaceutical PDAs, pharmaceutical, what's that called? Assistance programs, basically. And we help the patients fill out the paperwork, the doctor approves it, and then we're able to send that in and they get their meds for a year based on that. Overall, our numbers, for every dollar that we get from the outside in terms of donations, we're able to provide $20 in health care. So I think it's a pretty good return on an investment. If you take a look at 21 through September of this year, as I mentioned, we continue to implement the Dispensary of Hope Pharmaceutical Company program. We have gone to all in-person appointments now, with the exception of some of our counseling. Our counselor still does some of his interviews by phone. I think our patients got used to that during the pandemic, and they really like it now. They didn't at first, but we continue using SSM for our outside scripts. Our average cost per month that we were paying SSM was $31.50 per month, which was down 10% from the year before. But that number, I think we've maximized our productivity from that program. The decrease of 10% is really more due to fewer patients getting medications. And I've got a chart on that near the end of the presentation. So I think one of the really cool things is our counseling that we're able to provide. Believe it or not, we've been off and on with a counselor for the past 10 years, but we hadn't had one for a couple of years. And lo and behold, we got a counselor in March of 2020, right? I mean, seriously, his first day was like the pandemic. It's amazing. So last year, which was his first full year, he had 514 counseling appointments, which was up 83% from the year before. The year before that, we had 0. So obviously this came, as you know, the pandemic's been hard on all of us, much less our patients who, have many other issues anyway. So it really came at a great time. And fortunately, our counselor has stayed. He actually works 2 days a week, and he sees like 7 or 8 patients each day. So it's been amazing. This year so far, he's seen 343 appointments. So it's pretty much going to be on par with what we did last year. So we did start implementing outcome measures. Actually, we've had these in the past. And as I've mentioned to you, we are not electronic with our paperwork and with our charts. So what we do end up doing is, basically going through all the charts. And I did a preliminary scope of that in June to see how we were doing. First of all, we didn't have as many visits because we're down in terms of our patients. And it seems like the patients we did have are a little bit sicker, especially this year, now that the pandemic's over and they're starting to come back. So let's see.
Do need you to wrap up. I'll give you just a couple more seconds.
Okay, we're pursuing local publicity in terms of trying to get our numbers up to make sure people know that we are open again and we're available. We sent flyers out to various food pantries and hospitals and whatever. And a really neat thing that we're starting in January is that we've designated $15,000 in our budget to help pay for transportation costs if there is a real issue with a patient, as well as dental services. I think like a week ago, we went into an agreement with Compass Health, and if our patient is referred to them for dental services, we will pick up the bill based on their sliding scale. So that is a new thing, and believe me, it's needed. We have so many patients that come in with that need antibiotics before they get a tooth pulled, and then they can't afford it, and it's just a vicious cycle. So, the next 2 pages, I won't. Just a sec. Are just some metrics in terms of our Dispensary of Hope medication program, and as I indicated, I think we've gotten the most out of that. You can see how we've taken our medication costs anywhere from about $8,000 a month down to $3,500 a month or $3,100. And then on the last metric is the initiatives that we took in terms of trying to decrease those medication costs, which is part of what you all pay for. And once again, I think it's pretty much leveled out in terms of that. So, okay, with that, thank you again for your ongoing support. We really appreciate it. So, questions?
Tell me about your counselor. It seems like he stays pretty busy. What's he talk about? What's he do there? How's he help?
I mean, he has, a 30-minute appointment with patients, and they just talk about their problems, and, he tries to, do his counseling thing. So, but I mean, he will see.
Mental health then?
Oh, definitely. It's mental health. It's mental health, in terms of the problems they're having at home, or they're going through a divorce, whatever. It's the same kind of things that any of us would go to a counselor for. But as you can imagine, with so many of our patients having chronic illnesses, that also contributes to, mental issues. So, and they're in maybe unstable, family environments or whatever. So it's just, a lot of times just having a voice. And obviously he works with the doctors in terms of if he thinks someone might benefit from an antidepressant and vice versa. Our doctors will refer to him. So, but I mean, that it's been wonderful. The timing was just miraculous. So. So the counselor then refers them to a doctor if they need antidepressants? If he thinks so, absolutely. So it goes back and forth. Yeah, our docs refer to him, and it's just great. I mean, to have someone, 2 days a week is just amazing. So he stays very busy. So obviously they like him.
Other questions? I'd say kudos to the organization with the one word that comes to my mind whenever I interact with you all is scrappy. That you are very innovative in identifying ways to multiply a little bit of money. The loaves and fishes analogy is perfect. And just want to recognize you all again for the outcomes that you had in your application and the goals that you have to help people better manage their chronic health diseases and health issues. So just want to recognize you all that you've made lots of leaps and bounds over the years, and so just want to recognize that.
Okay. Any other questions?
I'd just like to say just one comment. So the fact that you have no paid staff, I found an observation in the nonprofit world that that's both a curse and a blessing to not have paid staff. Because continuity can suffer when you have completely 100% dependent upon volunteers, but you're making it work.
And I think a part of that, I think if you have younger people that are also working, whatever, that's a little more difficult. Everybody's retired. 95% of us are retired, and they've been in healthcare. A lot of dedicated people, seriously. So. Okay,
All right.
Thank you.
Thank you so much. All right, next up, we are halfway through Salvation Army.
Good evening, everyone. Pierre Hampton Regional Shelter Administrator for the Salvation Army. Been around 14 years. I've been doing this about 6 years, so Welcome, everyone. Welcome to the board. Welcome to our partner agencies. We went in the room. We may not have brought enough handouts, but they're coming around. So we get an extra 5 minutes, right? Because it's not okay. But don't hurt to ask. Okay, good evening, everyone. This is Salvation Army Community Assistance Board FY23 application presentation today. I'm gonna talk a little bit about Salvation Army, our goals, our intents, and Bridget McKinney is our shelter manager. She's been on board with us about almost a year now. So Salvation Army, mission statement, and you can read along in the handout. International Movement is an evangelical part of the Universal Christian Church. Its message based on the Bible. Its ministry is motivated by the love of God. Its mission is to preach the gospel of Jesus Christ and to meet human needs in His name without discrimination. And that's what we do at the O'Fallon Lodge. 150 years of service. Founded in 1865 by William and Catherine Booth. Street outreach became a ministry as he met with people on the streets. He didn't have the shelters at the time. He didn't have the on-site centers, the safe havens at the time. He did immediate work on the street to meet the needs of those he came in contact with. The Christian mission that he did and the volunteer army became the Salvation Army. Salvation Army is worldwide. Salvation Army is regional. We're operating in several continuums across Missouri and Illinois. Through shelters, treatment programs, we offer, someone mentioned veterans. We work with GPD program for veterans. Our own treatment center is our own in-house treatment center, Suboxone Methadone maintenance clinic inside, and also Athenia Healthcare for those people that come down there. And also we refer some of our families from O'Fallon Lodge to Midtown as well. Also our Ferguson Empowerment Center, which works with in that community over there. Also partnership through the Foundation of Health with Christian Northeast Hospital to address those health disparities that young lady mentioned in terms of volunteers in medicine. And just other various needs, housing for youth, housing for seniors, things of that nature, okay? If you look, this is a picture of the O'Fallon Lodge. It's like home. We like to create a home environment. It's not so much, programmatic. We encourage folks to individualize rooms, to decorate their rooms. We encourage kids to come home, sit in the lounge, do their homework, things of that nature. I'm going to, at this point, turn it over to our shelter manager. She's going to talk about our program description.
Good evening. My name is Bridget. I am the shelter manager. I serve a dual role, and I'm the case manager. So at the O'Fallon Lodge, we serve single women as well as families. We serve up to 24 people. We have 7 rooms. One of the rooms has four sets of bunks, and currently we can only put 4 single women in those bunks because of COVID restrictions. Our approach is to meet all our clients where they are. They could all come to us for the same reasons, but yet for different reasons. We might have people come to us because they have just recently lost their home, such as getting evicted, or maybe they were living with someone and the family member asked them to leave out, or it might be due to substance abuse. CAP funding has continued to provide vital services for the shelter, such as operational costs, staffing costs, and assistance to individuals who transition to permanent housing. So far, as everyone has mentioned, housing out here is very difficult. Our clients, they come to us, and with evictions, they have no jobs. They have very little savings. They're on Social Security. And out here in St. Charles County, housing is very expensive. So trying to transition them to permanent housing has been a very great challenge. But we try to overcome it the best that we can with the resources that we have. We are still implementing shelter in place. as far as COVID restrictions, due to it being a congregated setting, we're trying to keep COVID out of our building. So we continue to ask our residents as well as staff to wear face masks. We do the daily cleaning, keeping everything wiped down. With some of the CAP funding, we have been able to provide housing assistance, utility assistance, as well as provide gas cards. Our temporary additional 30 days, but within those 90 days, they're supposed to be working on goals that we sit down and talk about. We write goals, we do action plans so they can, be accountable for the steps that they need to take in order to reach those goals. I meet with the clients at least once a week, sometimes more, just to do follow-ups to make sure that we're on track with their goals. We do focus groups, which we build life skills. We do personal wellness, communication, employment readiness, and conflict resolution. As you know, being in a shelter, the clients, they're in a different environment and rules and getting along with people that they do not know, that's a challenge for them as well. So we do conflict resolution. We serve them 3 nutritional meals a day. Our breakfast is continental style. We have a chef that does lunch and dinner. We encourage our families to sit together, and all the single women, they sit amongst themselves. While they're there, any barrier that they may have, we work on those. Any community support that they need, we resource out. We have a good collaboration with, pretty much all of you all. And we welcome each organization into our building to do their case management services. We also have pastoral care where our officer, which is an ordained minister, he does spiritual assessments with our clients to, see where they're at spiritual and if they need if they would like to, be prayed with and other services like that. Where am I at on time?
2.5 minutes.
Okay. Some of the trends that we have in our at our lodge is we continue to see an increase in single women, also an increase in youth in our shelter. So recently, in this past year, we have gotten several youth from the ages of 19 to 21 due to youth in need not having enough space. So we have seen that increase. We try to find somewhere else that they can go to in St. Louis. Sometimes those shelters are also full, as those women, those young ladies, they really don't fit into our congregate setting due to the ages of most of our women at the shelter. We have seen single men with children, and we have seen an increase in mental health where they're not being actively engaged in services. And over 50% of individuals have reported some type of disability. Okay. Once submitted, this is our advisory report this is our last advisory report. It's from August of 2022. 75% of our persons entering are expected to transition to a long-term housing solution. In August, 4 out of the 6 families that we had moved into permanent housing. 75% of persons entering are expected to increase their income through employment or obtaining mainstream resources. 3 out of 3 of the individuals that did not have any income that were admitted into the shelter during the month of August gained income. So that was a plus that all 3 of them was able to get income. Whereas 100% of our school-age children are expected to be enrolled in school within 1 week of entering the shelter, and of course all 100% were entered into the school.
So just right quick before we run out of time, what makes this our work is partnerships, and it's partnerships around the table, partnerships we have established in the community through affordable housing partners, just getting anyone to establish not short-term but long-term connections with our families, and also working with those families to eliminate barriers that they may have. Also, Bridget kind of touched upon, we have a Pathway of Hope, which is like an aftercare follow-up program. So when families move out the shelter, and this is coordinated through our community core, that case manager follows up with them for the next 6 months or so. So that case manager makes regular contact with them on a monthly basis. Like you said before, check in, see how they doing, and that family can call back, especially if they need assistance or anything like that. One last thing before we go is statistics for the year, period of January 1st through September 30th. We've served 49 adults and 36 children. That represents 43 households, 21 single households, 22 families. We provided 3,482 bed nights during this period. 18 households moved to permanent destinations and 10 households moved to temporary destinations. This includes short-term stays with relatives, family, and also folks who moved out to hotels. And also, we'd like to thank you all for reviewing our application and for the partnership around the table. It's a hard, challenging work. I feel sometimes we get difficult families, but we stay with it because we know that these people need our help. And like Bridget mentioned, sometimes we can't do it at O'Fallon Lodge. Salvation Army is very connected. We refer them to St. Louis County, St. Louis City. We put a young lady in my shelter in Alton. So we try not to let a person just be out there on the streets if we can help and, you know, look at other resources. So thank you.
I had one question related to that with your aftercare program. What do you find with most of your families, are the people that you served, are they able to maintain that housing, or are they, becoming homeless again and needing to go into another shelter? What kind of data do you have on that?
We have some. Now, most families that we move out, we help them with the CAF fund for security deposit, first month's rent. Most of them are able to maintain housing. I would say maybe like 40, maybe half that move out. Some of the families that move out, because keep in mind, we operate a different system here in St. Charles. So we operate Case-Worthy. We still use Service Point in St. Louis City, St. Louis County. So because I kind of work with the various continuums, I'll see the family in another area. The name will come up, and I'll say, oh, okay. Because things do happen to folks. Sometimes we move folks out, they lose their jobs. They may not come up to the O'Fallon Lodge, but they may come to Family Haven. They may go to Gateway 180, Loaves and Fishes, the shelter. So I kind of see them at that point because we kind of see the names, and we all kind of share clients. Either one shelter, they're there 3 months, they come to us 3 months. So that's how we see them. Now, sometimes our case manager and Pathway to Hope can kind of track that person and then let us know, hey, and they're having some housing issues. And sometimes we say, okay, we'll take the family back into shelter. But sometimes the family, after you've been through that road, they want to go to a different environment.
So I do have a success story on a situation like that. We had a lady that came into the shelter with 2 children, and she was living in her car for a while. She did not have a job. So being in the shelter, it gave her a chance to be able to save her money. She had 6 evictions. Day after day, we was just trying to identify landlords, and we could not find anyone that was willing to rent to her. After about a month and a half, a couple of weeks into the shelter, she got a job. She was able to save her money. We connected her with Mr. Cruz to help pay her storage. So we were just trying to do steps to help her save as much money as possible. We found a landlord. The landlord was not willing to rent to her unless she had 6 months worth of rent to give him. So being in the shelter, she was able to save 5 months of rent, and of course we were able to help her with the CAF funds to pay for her security deposit and 1 month of rent. So she's still in housing. She does utilize our Pathway of Hope program, which is connected to our shelter. She comes there for food. If she needs help with any utility services, the Salvation Army has helped her with that, and she's doing very well, her and her children.
That's a hard one.
Okay, thank you.
Just off the record, I was gonna just share that overall, our COC has about a 10% recidivism rate over 2 years. So the people who come through and get rehoused, and we successfully rehoused around 350 people last year. And so then, we track them for 2 years, but just for overall. It's really good. It really, I mean, it really is. If people understand the system works, and it's a lot. It's a lot to do, but overall, yeah. And then we're starting to look at some of the ones that disrupt sooner and what kind of extra services might they need. But that's what the data tracking allows us to do, so.
Well, yeah, that you can then start to really target
Really
your
honing
resources
in on
better,
who's
right?
not being as successful.
Yeah.
We've come a long way.
All right. Well, tell me when you're ready.
I'm ready.
Okay. All right. So this is Our Ladies In.
Yes, good evening, and I first want to offer our gratitude to Community Assistance Board for the financial support you give us to help us do the work that we do. Our Ladies In is, we provide families shelter and support in their efforts to live healthy, productive lives, achieving educational goals, gain employment, and secure stable housing. Our Ladies In has served a life-affirming alternative to abortion for almost 7,000 women who have chosen life for their unborn babies. So how we do this is through a holistic service program offered in a residential setting. We call Our Ladies In a home because that is the atmosphere that we've created for our families that come there. We do have it structured to where moms who may not have been structured before, we have things on the timeline. There's 3 meals served a day, breakfast, lunch, and dinner. And then we also have responsibilities for the mom to give back to Our Ladies In because we charge them nothing for staying there. So we ask that they have household responsibilities and that they just keep not only their private rooms clean, but they help us keep the facility clean as a way of them giving back. So I want to just kind of talk about the timeline. We began Our Ladies In 1982, and then in 1989 we began a 2-year aftercare program. That program follows our families for 2 years upon their consent to make sure that the same case management that was provided in-house is going to continue with them. If they're in their own housing, the case manager will go to their home. She will visit with them. If they need rides to legal appointments, doctor appointments, some women may be working in the reunification program with Children's Division. She will walk them through that. So in April 2006, that's when we opened our home in Defiance for St. Charles County. In 2007, we added our counseling service. And what our counseling service does is she does a psychoanalysis, and then if there's any other assistance they need with their mental health or emotional wellness, she will outsource that to another agency. We may go to Compass Health or any other counseling services that are available. In 2009, we did open a resale shop, and that's used basically for our South House location, where they will employ our ladies that live there to give them some employment during their stay. And in 2018, we took on the trauma-informed care approach in working with our clients. Many times our ladies come in, they have had lives that were, they experienced trauma from a young age, domestic violence. There has been substance use, incarceration. We have an array of women that come into our care. So our approach is not to say what is wrong with you, but what happened and how can we help you work through things in a different manner as opposed to making a judgment statement. And we find that this is more receptive to the women that we care for because now they know that they're not someplace where they're just having shelter, but there's someone that cares. Our service is for women who are 18 years and older. She has to be pregnant and she has to be homeless. We serve their dependent children, and they can stay at our shelter for up to 12 months. And like I said before, there's no cost to the client. So when they come into our shelter, they have their own private room, and we provide them with the immediate needs that they need to sustain themselves. Case management is what each family, is required to do. So I'm just going to kind of take you through the process of Our Ladies Inn. We start with a referral. We may get a referral from Coordinated Entry. I may get one from the Women's Center. I may get one, Crisis Nursery has even made referrals because families are everywhere homeless and moms are pregnant and they are in need of service. So we begin that with what we call a shelter call. On that shelter call, it's like a triage where we find out what is exactly going on with the family and if we are able to provide that service. Some moms are not ready for a service and some moms are. But in that shelter call, we give them the information and we ask them to think about it if this is something you want to do, because it takes a collaborative partnership between us and the family. So once they come in, they do several intakes. They do an intake with their case manager, and she is the one, their very first go-to. She helps them set up what we call a person-centered plan. They list their goals, and those goals follow them throughout the program. Once they complete a goal, then we add another goal. And the moms can stay there for up to 1 year, providing that they are productively working a program. We don't want anyone there just sitting and not doing anything, because it is our earnest intent to help them move forward back into the community, help them to start a healing process with their emotions and mental health, to make sure that their pregnancy is going well, because we're ensuring that you get to your doctor's appointments. Your children are having the services they need, because just as the mom went through traumatic experiences, so did their children. They were recipients of whatever the mom went through. So it starts, with the case manager, and then we have a nurse who monitors their medical situation. Do they need to go to a dentist? Do they need vision care? Do they need something for their children, like occupational therapy or physical therapy? We have a child advocate who is the case manager for our children, and she helps the mom connect to the services that they need. And they're the ones that usually reach out to make sure that our school-age children are in touch with Francis House School District so that they can begin school, to make sure that they have pediatrician, to make sure that they have everything they need to take them to health and wholeness as well. We have well, that's pretty much all of our program staff. So residents share in household activities, learn life skills, and establish goals through an individualized plan. So no family's plan looks alike. And a lot of times we have to tell our families, our moms, focus on your program, because what this client is able to do, it doesn't fit her lifestyle for her to do. And sometimes they see things and they want to make comparisons because they talk. We ask them that, we have up to 1 year to get you on track, and what we need you to do is focus. So we have multi-session trainings, including parenting, nutrition, employment readiness, educational preparedness, stress management. We were, and we still do, smoking cessation, but just a few months ago, we became a non-smoking campus. Smoking was always something that kind of was an add to staff, but we allowed it and made accommodations, because a lot of our moms had mental health issues. And you weigh the pros and the cons, the benefits and the risks. Smoking was better than them going back to substance use. So, but we have cut it out, and we're kind of pushed us that way more this year is the legalization of THC. And we were getting phone calls, and a lot of our ladies come in with substance use histories, and THC is pretty much on the rise. So coming to, beginning to be a non-smoking campus, they may test positive when they come, but there is no provision for you to engage in that activity on our campus. And we do still work with them with education around substance use and referring them to preferred family health if they need an assessment because they are using. And we work with those programs. They also attend Celebrate Recovery, AA, NA. And that's just so that while they're there, they can do some healthier ways of coping with life as opposed to turning to those things that are mind altering. So as I mentioned before, our aftercare program, it offers 2 years of continued support to each family once they have moved. And they have continuity of care through management, advocacy, transportation, housing referrals, and material supports. They work with families during in-home visits, or we also do it at our administrative office for those that are in our St. Louis location. We had opened a, is that the bell? Okay.
So I'll let you wrap up.
Okay, that was quick. So what we do is we have a pay it forward program in which we have our ladies engage. If they're at home during the daytime and they're not working just yet, then we have professional jewelry makers come in, and our women, a lot of times they'll say, well, I don't want to make jewelry. I don't know how to make jewelry. I said, well, you don't know how creative you are until you make jewelry. So they would go there, and this jewelry is used to bring an income back into our ladies' in. And so I'm going to wrap it up. Are there any questions?
Thank you. Yeah, questions.
It's your transportation. I've seen your vans around. I think I've seen vans for Halloween.
Well, we don't have, it's not logoed or anything. No, we just have.
So how do you get the people around? Do you have contract with Uber?
No, we have staff. We have staff. We have a transportation coordinator. And what she does is she coordinates everyone's schedule. They have to turn them in on Wednesdays by 3:00, listing the various activities for the next week. And we schedule it that way. Sometimes our ladies may have an appointment that comes up at the last minute. Then another staff person would transport. But we do have 2 7-passenger vans, a Chevy Cruze, and a 12-passenger van. So we transport our ladies.
So you using the company vehicles and not staff vehicles?
We use company vehicles. They just don't have our name on it. Okay, well, it wasn't the one for St. Charles. Maybe it was their end, not ours. Any other questions? Okay.
So if you said they stay there what, 12 months? Is that
They can stay up to 12 months.
Does that include before pregnancy or during the entire pregnancy and then after?
So 12 months begins the day of entry. So if a mom comes in and she's 2 months pregnant, then she's going to be there 10 months after the pregnancy. And if she's right there at getting ready to deliver, the day that she came in, she still has up to that 1 year. They get 1 full year from the date of entry. Any other questions?
When your clients leave, again, kind of looking at housing, are they leaving oftentimes to permanent housing, or what happened? What's that path once they leave you?
Unfortunately, housing is an issue in St. Charles. So a lot of times, wherever our ladies come from, they may not always come from the St. Charles area. We try to find them housing in the area in which they want to return to. So we have a better success outside of our area. A lot of times they may return to family, or they may return, to another shelter. It just depends. we had a young lady that we had gotten from the Women's Center, and she ended up transitioning from us to Maryland because she found a transition home that was basically around her culture. And so we, made provision for her to go there, and she would just work with them.
When a baby's delivered, what hospital do they go to?
They can go to whatever hospital the mom is comfortable with. We use Mercy a lot. Women that come in with substance use history and pregnancy is pretty much considered high risk. They go to St. Mary's and they participate in what they call the WISH program. And this is where the staff are educated in working with women with substance use and mental health.
Do you ever have anyone name a baby after you?
No.
Not yet.
Not yet.
Not yet.
Not yet. I'm gonna have to talk to them. Yes, but no babies named after me. But and I am Denise, the program director. I'm sorry, I just came up here and started talking.
What's a pretty name?
Thank you. Any other questions?
Thank you so much.
Okay, thank you.
And then last but not least, we have Connections to Success.
Alrighty, we're right on time here. Good evening. I am Linda. I'm with Connections to Success. We actually started as Dress for Success Midwest in 1998. So a lot of individuals know us still as that, and that was just providing that career and interview clothing for women that were coming out of different experiences, whether domestic violence, homelessness, any obstacle that they were facing, basically. And we soon realized we needed to do more. And so that's how Connections to Success came about. So like I said, we've been in St. Charles County since 1998. Our original founders did step away about a year ago now. So we're under new leadership. We are located here in St. Charles, which is our headquarters. We have an office in St. Louis City. And then we have 2 offices that serve the Kansas City metropolitan area. So we are across the state of Missouri. So really, our main focus is employment, and so understanding that is a huge part of helping individuals get out of either a homeless situation or a near homelessness. And so we're not a placement agency. Some folks call us and say, hey, I need a job. And great, we can definitely help you there, but what more can we do? Because we know nowadays it's not about just securing that job. There's help wanted signs, staff shortages all over the places. So we know finding employment isn't necessarily the issue. It's finding employment that's a good fit for the individual, that job retention, and then that career growth towards the economic stability. A job for $10 an hour isn't going to cut it nowadays. $15 an hour barely cuts it nowadays. And so we're very intentional with the programming we offer. So it's just, again, you may need a now job because you've got some of those immediate needs that you have to fill. So taking that $10, $12, $15 an hour. But then what can you do to improve that pay? How do you get a promotion? How do you then find a career that is both financially rewarding and fills that passion? And so that's really kind of how program has developed. We rely heavily on our community partners. We don't claim to be able to do it all. We definitely help individuals create that plan so that they can achieve success in all of those areas that we know is important. If one part of your life is a mess, it's really going to impact then how you show up on the job, and then your performance and your pay and all of that is going to be in correlation to that. So it really starts in a cohort setting. We tend to have anywhere from 8 to 12 individuals. They go through a 2-week personal and professional development class, and that's really kind of the core of what we do, really kind of creating that trust. They get that peer support amongst each other, and they go through kind of a series of components within that 2 weeks. It used to be 3 weeks. We actually condensed it to 2 weeks. Coming out of the pandemic, we realized that people had so many immediate needs that committing to a 3-week program seemed a little overwhelming, and we saw our success rate of completion go down. So we made some of those adjustments, and we'll probably continue that for a while. So during those 2 weeks, they're really working on that cognitive skills development, really understanding who they are, what are their strengths, what are their assets, how can they take some of those experiences that may have been negative in the past, whether that be criminal justice, substance abuse, some of those family relationships, how can they spin that around and actually learn from that and use that and own that to demonstrate what their strengths are now. So that's really a big piece. Family dynamics, conflict resolution, especially in employment, and then moving into some of those more hard skills, resume development, interviewing skills, just those interactions with their peers and that support. So we have, our mission is to obviously break the cycle of poverty, and that's a very, very we all want to break that cycle, right? But how do we do that? So we do hope, resource, and a plan is really what we focus on. And again, someone will say, what does that mean? What is hope, resources, and a plan? So like I say, we really put that self-esteem, that confidence builder, and really providing that hope and that support that these individuals are often lacking. Those resources, that's what all these community partners are, those resources. What we can't do, we then go and seek and create those relationships and partnerships to help then steer individuals towards those services that they may need. And then the plan, because we all know that we're not going to accomplish anything if we don't have a plan. Things aren't just going to fall into place. And so during that 2 weeks, they create an individualized program plan. We focus on 9 areas of an individual's life: employment, housing, financial, social, education, family, spiritual health, and transportation. And not to say everyone that walks in the door has a concern or an issue in all of those areas, but we do make them create a life plan in all of those areas. So at the end of those 2 weeks, it becomes more individualized. They'll get a life transformation coach. Most people call them case managers. We like to call them life transformation coaches. They get a job developer, and then they get a mentor if they choose. Our mentors are volunteers. Not everyone wants a mentor immediately. They realize that they want one down the road, and we've got volunteers kind of ready and waiting. But what they do is they look at that individualized plan, and then we figure out what is it that individual needs at that particular moment. It may be those immediate needs. It may be suffering food insecurity, transportation issues, utilities are about to be cut off, whatever that is. We work and I think a lot of people have mentioned that, is that no one's path is the same. And so we really fine tune what it is that this individual, we don't tell them what it is to be successful, they define that. We just help them get there. So we don't do things for them, we walk alongside them. So one person may just need a ride to their job. Great, we've got you covered. One person may just need a referral to a food pantry. Someone may need some education gaps filled, and we'll seek to see what kind of, do they want to go back to traditional school? Do they want to do a voc rehab program? Whatever that looks like, we'll kind of direct them in that, providing those resources as much to our ability. So it really is wrap around. We rely, like I say, heavily on our community partners. Ultimate goal is for them to secure employment that does fulfill their financial needs, does give them that stability for housing, stability with transportation, and to be able to provide for their family. We work very heavily with the reentry population, so we definitely want to contribute to those recidivism numbers. We are proud to say that our numbers are 10% or lower. Missouri is around 28% of individuals that do return to the institutions within that first year of release. Nationally, it's 44%, so to say that it's 10% is we're very proud of that number. And we know a lot of that is support. They're reunifying with their families, their spouses, their kids, and it's a struggle for a lot of them, some of whom may have served 20 years. So coming back, and we all just expect them to pick up where they left off. That's not always the case. So just being that support, knowing they can pick up the phone and call us, text us, whatever that looks like, because once you enroll in the program, you're stuck with us for life, whether you want us or not. We're here. Some call us every day, some call us once a month, some may call us every 6 months, whatever that looks like for them. And they may be doing really well. Something happens, they come back, we'll kind of get them back on that straight path again. So it really is just kind of wrapping our arms around them and supporting them with whatever their needs are. And if we don't know how to do it, we'll go find it. So we know trends change, needs change. I think someone talked about the counseling. With the counselor right at the pandemic, we actually were fortunate to receive some funding to have a telehealth professional that we had on a monthly call for our professional women's group. And the feedback was tremendous. It was like they were experiencing depression, isolation, just the stress of being overwhelmed, job loss, caring for the kids, all these things at one time. And so to have the opportunity for that telehealth was so crucial, and we heard great things from there. So just, like I said, if we don't have it in our possession at the time, we'll go out and find it. And so funding from CAB has been crucial in that case management, employment training, certificates that we've been able to provide, whether it be something as simple as steel-toed work boots or going and doing a food handling certificate, whatever. Again, those needs are for those individuals. We want to, and transportation, especially here in St. Charles, it's huge. So we have a passenger van, We do occasionally rely on some staff vehicles to do some transportation, but we do prefer to use that passenger van as much as we can. So if they can't get to us for the training, we'll pick them up, bring them to, if they need support with a job interview or employment. Obviously, we're a small staff, so we can't accommodate every request, but we do what we can. And then we have done Uber before, we paid for Lyft before. So anything, there's some grants out there that have allowed us to put gas in someone's car, whatever that looks like. So again, if we don't have it at our fingertips, we'll go out there and find it. And then programming beyond that is very intentional. We have peer-to-peer support groups, we do financial literacy, so we have some great banking partners that do credit repair, training, first-time homeowners. I'm trying to think of some of the others now, I'm blanking. But again, it's what they say they need, we'll go and get. So that's it in a nutshell. Trying to keep us way ahead of schedule here. Any questions? I'm probably missing lots of things, but.
Any questions?
You still make cookies?
We don't. I know. You've been around a while, yes. So yes.
That's been a while.
It's been
You've
a
got
while.
a good
Yeah.
memory.
We used to have a commercial kitchen. We had a great cookie program. We made bread, and then we transitioned to making lunches. It was a great transitional employment for folks. But then when we moved, we lost the commercial kitchen, so it became a struggle. But they were good.
They were.
Yeah.
I remember those.
They were good. Put on a few pounds. I'd walk in, there'd be cookies, bacon, and bread smell. I'm like, oh my gosh, you guys are killing me. So, yes.
Your application says that you do work with veterans.
Yeah.
Do you get very many veterans?
It fluctuates. I would say probably about 10% of our individuals. So we kind of see folks come in two different directions. So individuals that enroll into our full program and receive all of our services, and then we get a lot of individuals directly to the Dress for Success program. A lot of individuals refer to us from Heroes Care. A lot of individuals from St. Patrick's Center that have veterans, that are veterans, just needing that clothing piece. And so I would say about 10% of our program participants are veterans, but a lot of our Dress for Success referrals are we've supported some of those, like some of the big hiring events that are specific for veterans in the community, the Welcome Back Heroes events, it's been a couple of years since we've physically been there. Just we used to have a mobile unit that's not operating anymore, but we've provided vouchers and individuals are coming to us now, but we do see a lot of veterans.
So just for anybody here that actually serves veterans, been two pieces of legislation recently passed that benefits some of the old guys like me, the Vietnam vets who were exposed to Agent Orange. That's called, and the young guys who've been under burn pit exposure in Afghanistan and Iraq. So they have an entitlement that they just need to be directed. Not everybody is in contact with veteran service officers and so forth, but if you can just think to direct them to a veteran service officer. Now you'll see a ton of ads for lawyers who want to process their cases for the Camp Lejeune water thing. That's a whole different bear. Those of us who were at Camp Lejeune, we may or may not everyone has to file a lawsuit, but in order to get veterans benefits, they have to apply. And if you send them to a lawyer before they've gone to a veteran service officer, the lawyer gleefully handles all of it and takes 35 to 40% of it.
Okay.
So
it's good to know.
So
Sure.
just think about that. If you have a veteran that, a young guy's a veteran, ask him if they served in the Gulf Wars, or if they're old folks like me, Vietnam, and make sure that they've gotten those. The Camp Lejeune thing, will be mostly Marines and Navy guys and their families.
Okay. Good to know. Thank you.
Very good. Anybody else? All right. Well, thank you
All
so
right,
much.
thank you.
Well, thank you everybody for being here tonight for some great presentations. Always sobering when we hear about the needs in our community, and at the same time, it's joyful to know that we have such amazing agencies who continue day after day to meet the needs in our community. So thank you for what you do. I will ask that our next meeting will be back here in, God forbid, unless there's another COVID spike, but we will plan to be in person. Oh, that's right. It's not the 8th. It's, we moved it to the following week, right? This, yeah, whatever that next, yeah.
November 8th is election day.
Right.
So
We did, yes. So
go
it
vote.
is,
We don't care who you vote for, but go vote.
yes,
That's
correct. We are neutral on who you vote for. Thank you for that reminder. I totally forgot that. Okay. In this venue, we do not care who you vote for. I personally have very strong opinions, but I will not state them here.
Just go vote.
Yes,
I don't wanna
please
hold
go vote.
anybody up.
Okay, so it'll be the following Tuesday. We'll be back here, and again, we'll start at 6:30. So just as a friendly reminder, it starts at 6:30, and Pinar will send me the list of the remaining agencies who will be presenting. But anybody have any questions before we adjourn?
I got a comment.
Yes.
I'm amazed of all these, the coordinate, like you said, the coordination, all of these agencies. I don't think there is a single agency that applies for this money that doesn't deserve the money they get. Our problem is trying to figure out what needs are here, and right now we know they're really bad everywhere. But it's just amazing to me as the county does this, where I think we're ahead of the game in a lot of places.
I totally agree, 100%.
It's wonderful to see. No,
Yeah,
it is, yeah.
I do have a quick comment. So as everyone knows, it is Domestic Violence Awareness Month. So we are partnering with the St. Charles Police Department and hosting a event at the Darting Perry Target and a couple other corresponding groups around there to kind of help us get some stuff for the shelter. So we do have a Target registry if you would like me to pass it around. if
Okay,
anyone's
sure,
interested in
absolutely.
taking one.
Very good. All right. Yeah. Oh, you know what? They were getting ready to present when it came to me, and I totally forgot to keep it passed around. All right. So please sign in.
I move to adjourn.
Yep, please. Thank you. Do I have a second to adjourn?
Yes.
All right. Those in favor?
Aye.
Okay. We are adjourned. Thank you, everybody. Enjoy the rest of your